According to the CDC, more than 100 million Americans have prediabetes and diabetes. I've had some of my patients taking metformin tell me they are taking it for prediabetes to prevent diabetes. This never made sense to me because type 2 diabetes can be reversed and prevented with lifestyle changes. The first step towards lifestyle changes starts with food, so educating those with diabetes and prediabetes about nutrition is so important. Prediabetes is when glucose is elevated above normal during fasting, but the pancreas is still able to make and use insulin to utilize glucose for energy or store it. When someone has prediabetes, it is important that they start making lifestyle changes because if they don't, they'll go on to develop diabetes, or some women can develop PCOS, which is polycystic ovarian syndrome, a metabolic disorder causing insulin resistance and hormonal imbalance. Prediabetes also increases the risk of Alzheimer's, cardiovascular disease, kidney disease, and stroke. So what are the foods that cause prediabetes and diabetes? Red meat and processed meat, such as bacon, sausage, and deli meat. Foods that have processed ingredients and added sugars, such as high fructose corn syrup, molasses, and cane sugar. And that's just to name a few. There's so many more out there. Beverages that contain added sugar and even artificial sweeteners, found in sodas, fruit juice concentrate, vitamin water, sports drinks, and alcohol. Refined and processed carbs, such as white bread, pasta, flour, crackers, baked goods, and cereals. Foods that are canned, packaged, and frozen contain added sugar. And even sauces, condiments, and dressings have added sugar as well. Those that have prediabetes and diabetes can definitely benefit from higher protein and healthy fats, as well as less simple carbs. I definitely recommend avoiding all those foods that I just previously mentioned and focusing more on whole, unprocessed foods. So what are the best foods to reverse diabetes and prediabetes? Organic lean meats, such as chicken and turkey. Wild caught fish, low in mercury. And this can be remembered by the acronym SMASH, which is salmon, mackerel, anchovies, sardines, and herring. Whole fruits and vegetables. Fiber found in leafy greens and beans. Healthy fats from avocado, nuts, and seeds. Also spices such as cinnamon, cloves, turmeric, and garlic have been known to help lower glucose. And then lastly, switching from those sugar-added beverages to water, which can be infused with fruits, vegetables such as cucumber and herbs to add flavor, or drinking herbal teas, which have so many benefits to health. So the biggest takeaway is to learn and educate about how to read a label to find those hidden sources of sugar and processed ingredients. The main focus should also be on whole, unprocessed foods and not eating packaged foods. For those who are eating meat, I recommend no more than 3 ounces per day, and the main sources of protein should be from plant foods. Also, controlling portion size is key, especially when it comes to carbohydrate intake. The main source of carbohydrates should be from complex carbs from vegetables and less from simple carbs such as grains and simple sugars. This is because complex carbs contain more fiber, which helps to stabilize glucose levels. So this concludes my video. I hope that this has given you a lot of insight and empowers you to help others to make intentional choices to improve the quality of their health. I want to leave you with my motto: live with intention and be radiant.